Hi guys, welcome back to my channel. My name is Janice. I'm a registered dental hygienist. I have over 13 years experience in the industry, and today we're going to talk about why children especially should never ever mouth breathe or snore. I think because this is my job, I talk about it on a day-to-day basis. It's just such common knowledge for dental professionals, but I'm starting to realize a lot of people do not know anything about this. This might be the first time you're ever hearing what I'm about to tell you. If you find this interesting, which hopefully you will, please share this, especially if you know anyone that is pregnant right now, thinking about having children, have small children, especially under the age of 8. What I'm about to say could potentially transform their appearance, their health, and prevent a slew of problems in the future. So often it's thought that our facial aesthetics, our facial appearance is purely genetic, purely from mom and dad, and that environmental factors can't influence how we look. Well, I'm here to tell you that is completely wrong. Oral posture is essential, especially if you have small children or you are young, for the health and the development of our face and our jaw. A child's oral posture determines the direction and growth of our jaw and our face, which ultimately leads us to the face shape that somebody has, the jawline that somebody has, and the overall attractiveness of somebody. So before anyone gets offended, I'm going to mention some things, and in no way am I insinuating if you have these things going on with your face that you're not an attractive individual. But in dentistry, which is my profession, probably in plastic surgery too, there are things we look for in facial features that are ideal. So desirable versus undesirable. And it just so happens that the undesirable features often mean unhealthy features as well. So these characteristics of a mouth breather often lead to more serious health problems in the future. This is something most dental professionals know, and I think we kind of take for granted. We have a lot of knowledge, and besides my patients, I don't necessarily share this with you guys because sometimes when you know like something is just your day-to-day job, you talk about it a lot at work, you just almost think that it's common knowledge. But I'm starting to realize a lot of people are clueless about this, and certain habits that you can modify when your kids are little will really change their appearance and the health for the rest of their life. So physical traits of mouth breathers I'm going to go over. So none of these are desirable. Again, I'm not meaning to offend anybody if you have this. I'm just saying ideally from a health standpoint, we do not want this. So it's very important if you have children, especially 8 years and younger, you can really change this a lot easier than if they're older than that. So number one sign, someone is a mouth breather, long face. Sometimes we call this long face syndrome. You might possibly have dropped eyes. So what happens is ideally the tongue, when it is on the roof of the mouth, how it should be, that's going to help with forming the infraorbital bone, which holds your eyes up. So there's also studies linked to people having certain conditions with their eyes just due to poor tongue posture. That's a whole nother video. We won't get into that. Also, usually little kids that snore or mouth breathe, when I see them at work, they're going to have big dark circles, sometimes puffiness around their eyes. They just kind of look sick or like almost that they were stung by a bee, but usually very dark under here. A lot of times, even at rest, they're going to just have open lips. It's going to almost look like they're doing that on purpose, but that is just how their mouth hangs naturally. So what happens is when we always have open lips, open mouth, what's happening is this lower jaw is not being trained to come up. And then that leads to a weak, recessed chin. So a lot of times people, if they have maybe got a chin implant, maybe they need to look into their oral posture and their breathing. So their chin will be recessed and very weak muscles. Also too, the cheeks will be sagging because when our chin is up and we have a strong jawline where it's supposed to be, it's going to push the cheeks up, little chubby cheeks. When we have a very long face, cheeks are going to sag. Also, you're going to have a weak jawline. It's going to be softer. It's not going to be sharp and chiseled. Mouth breathing, it can alter the strength of the organs of speech, alters your overall posture. So when your mouth is hanging open, a lot of times the neck comes forward. That can affect the bite. Often you're going to have a narrow horseshoe arch, crooked teeth, malocclusion, narrow nostrils. Usually upper lip is thinner, lower lip is a little bit poutier, dry, cracked lips, many more. Overall, not desirable features. A lot of those things, when you think about it, is exactly what people are going to the plastic surgeon every day to fix, okay? So possible reasons for mouth breathing: you might have a deviated septum, so you're just not getting proper airflow. A lot of times it's enlarged tonsils or adenoids. If you notice your kid is snoring on a daily basis or more than 3 times a week, you need to videotape them. A lot of times they might even have sleep apnea, stop breathing. You need to videotape them, show this to your doctor. If your doctor says, oh, don't worry about it, they're gonna grow out of it, or it's nothing to worry about, do not take that for an answer. Children should never snore, okay? It means there is a serious underlying issue and we need to get to the bottom of it. All healthcare professionals need to be on the same page about this. I think we're slowly doing that. A lot of times though, it's dental professionals that are gonna educate you and maybe notice this about your children. So make sure you're going to a good dentist and a good doctor. Do not take no for an answer. If you need to go see a naturopath, an ENT, pay the extra money, get your kid the help. Also might be allergic to dust mites, so make sure, especially keep their bedroom nice and clean, the bedding, hypoallergenic, maybe don't use feathered pillows, really dust the headboard, the sides of the bed, around the windows. Sometimes kids are allergic to pets, so maybe your cat or dog might have to go. I know that sounds a little harsh, but kids' health comes before animals. There is quite an interesting case study about this little boy. I'm going to put up a picture on the screen here. So you can see, I believe in the first picture, he was around age 7, quite a cute little boy. A little bit after that, his parents got him a gerbil, which he was allergic to. Then he started mouth breathing because of that. And then you can see how it has changed his facial shape over the years. So that's pretty shocking. It's too bad that happened to him, but that is an amazing example. Also, kids might be allergic to smoke, so definitely no one should be smoking inside the house. Don't smoke anything inside the house. Could be tongue-tied, so that should be something that's evaluated at the hospital by the nurse and doctors when they're born, or if they're having trouble breastfeeding, sometimes they can't latch on. Even with myself, my mom told me that was the case with me, so you can get a lingual frenectomy, so where they snip that little attachment there. Breastfeeding, it is very important in the health of the jaw and the facial features. I think I read it was often thought, like years and years ago, breastfeeding would last probably 3 to 4 years. Sometimes now it only lasts a couple months. At the very least, if you can do it, I know there's a million and one reasons why women are not able to breastfeed. I won't get into that in this video. If you are able to do it until your baby is 6 months old, that's really, really going to help the development of their face and their jaw. It's also very important not just to serve your kids that mushy, soft baby food right after they're done breastfeeding. If you can introduce harder foods into their diet, that's going to stimulate the jawbone and also the facial muscles. Again, I'm going to make a separate video probably about that, just so it's easier to find. So chewing a lot when we're little, chewing tough, fibrous things, it's going to stimulate the jaw to grow and become very strong, and this is going to allow it to expand and have enough room for all the teeth to come in. So usually the teeth will come in straight or less crooked at the very least. Chewing softer foods equals less strength in our jaw muscles, meaning you have a slack, weak jaw. So in turn, that's going to determine the face shape, and then it's probably going to make the chin be back and recessed. So certain aspects of our face and jaw are very malleable or moldable as we're growing and developing. And a lot of this is actually based on cultural and environmental factors and just maybe habits that we can instill in our children from a young age. So even if you see them playing or exercising, their mouth is always hanging open, just a gentle reminder, lips together, tongue to the roof of your mouth, practice breathing deep through your nose, teeth in light contact. Things that influence our facial shape and the structure of our jaw include what we eat and how we eat it, whether we breathe through our nose or our mouth, and correct oral posture. So where is our tongue when we're not eating or talking, essentially? So those three things: how and what we eat, correct oral posture, where our tongue is when our mouth is at rest, and whether we breathe through our mouth or our nose. So when teeth are kept apart and our mouth is hanging open, this causes abnormal growth in the jaw, which lengthens the face, and ultimately it's going to make it harder to breathe over time. So now we're at a point, okay, now you have a long face, it's harder to breathe, so what are you going to do? You're going to keep hanging your mouth open to get more air in there. When we're always breathing through our mouth, oh my God, it causes like a whole slew of other problems, which I'll get into. One of the functions of our tongue and our lower jaw is to promote the upward growth of our upper jaw, but we have to hold it together in light contact to do that. Obviously, this is hanging way down here. How is it going to promote the growth and the upward turn of our face? It's not going to happen. We're going to get that long face syndrome. So if kids chew mainly soft food and kind of let their mouth hang open when at rest, your jaw's not going to develop properly, and it's going to be too far back. So also to the muscles of mastication, chewing muscles are not going to be properly developed. So if our lower jaw is too far back, it leads to a receding chin and encroaching airway, which we do not want. So when our tongue is in the proper position on the roof of our mouth, it's going to broaden the arch of our teeth out. We can all probably think of someone in our head that has a very narrow horseshoe arch. So when they open, all the teeth are crowded at the front. The tongue is probably not on the roof of the mouth. So the roof of your mouth, the palate, is very malleable, the soft palate, which is a little bit further back than the hard palate. So when your tongue is up there, it's going to basically splay out the palate, making enough room for all your teeth to come in nice and straight. So when teeth are crowded, the face kind of collapses inward, making it look more concave. And then this, again, it causes receding jaw, weak cheek muscles, soft jawline. It's harder to breathe, and it's actually, it promotes mouth breathing. A lot of time if people have a very narrow horseshoe, a high palate, crooked anterior teeth, often they're a mouth breather. I don't even have to look in their mouth. I can see when I'm bringing them into my room, this person breathes through their mouth just from their appearance. So crooked teeth or severe malocclusion, it often indicates in a child that there's going to be a severe health problem later on in life. So malocclusion just basically means there's a discrepancy between our upper and our lower jaw when we're in centric occlusion. So some of you might be familiar with Dr. Mike Mew's YouTube channel called Orthotropics. So I just want to let you guys know, though, proper tongue posture and positioning is not something that anybody invented. This is correct anatomical positioning. Even I was reading, and you're taught this in any dental school, about, there's a book published by Dr. Angle. I think he wrote it in the late 1800s, published in the early 1900s about all this. It's just kind of like it's resurfacing now, I think, because people are very concerned with facial aesthetics and more than that, the health, right? We're looking for a holistic way to treat the body. So Orthotropics is a great YouTube channel. I will link it in the down bar. A lot of dentists or orthodontists don't practice this type of work because it takes years and years, a lot of patient discipline. Parents really have to be on board. It's usually more expensive, And not a lot of people are trained in it just because sometimes there's not money in it. There's a lot of issues. Another channel, I will put her name here on the screen. I found her channel. She's a registered dental hygienist, and then she became an orofacial myologist, which is actually something I'm contemplating going back to do training for as well. So she has a great channel here on YouTube. I would suggest if you have a child that is suffering with any of the stuff that I did mention, maybe you can see her. I think she does even treatment online, or if you can find an orofacial myologist in the area that you live. So I remember reading in a book, it said even within hours after a baby is born, they can start developing this bad oral posture that's going to affect their face shape and health. So that's pretty crazy. So you really need to get into the habit of, even when your little baby's mouth is at rest, like closing the lips, making sure that they can breathe through their nose. So if you have to use one of those little suction things to get out, any snot or things like that, because little babies get congested really easily, that is highly recommended that you do that. Just remember, your tongue is one of the strongest muscles in your body. Muscle always wins over bone. So I would say kids maybe 8 years and younger are going to have the best results with this. Definitely even past age 5, it gets pretty tricky to change things. Definitely over the age of 25, very, very hard. It's going to take years and months at least, sometimes years of practicing this. Not to say that things can't change on their own, but things are a little bit more set in stone. I remember an oral surgeon that took my wisdom teeth out said beyond age 25 and like each decade after, it just gets harder and harder to remove those teeth. Like things are really set in place in your jaw. So beyond age 8, it's pretty hard to change our maxilla, meaning the upper jaw. It can be done, but it's pretty hard. A boy's mandible is often more malleable beyond that. Often I've seen boys, even in their late teens, take a huge growth spurt and their jaw completely changes. Jaw development is definitely easier influenced when we're younger. So the earlier we can start, the better. So mouth breathing as a child, something that might look cute or something that you don't think is significant, it can lead to perpetual exhaustion in your child, crooked teeth, too little oxygen when they're sleeping. Human growth hormone is secreted between 11 p.m. and 2 a.m. So for children especially, when they're growing and developing, sleep is so important. So that's why I hate seeing kids on phones and iPads. That blue light is stimulating you to be awake much longer, and it's preventing you from going into that deep reparative type of sleep. So think about it. When a kid is mouth breathing and maybe they're not getting enough air, your body's main objective is to get air in. Okay, so it's going to stop doing everything else to get that air in. So it's going to stop growing, repairing, building just to get those breaths. So when we're not breathing properly, everything else kind of gets stunted in growth and development. So mouth breathing can cause the following, especially in children. So breathlessness, kids that tire easily, hyperactivity in the day because our epinephrine has to kick in, upper neck pain, taste impairment, halitosis, meaning bad breath, most likely because of dry mouth. Also, when we have a dry mouth, less saliva flow, then increased chance of caries or cavities. Wakes up choking at night, poor sleep, daytime sleeping, dark spots under eyes, sneezing, abundant saliva when sleeping. A lot of times too, it's thought because we're breathing in all these dust mites and allergens in the air through our mouth, you're more susceptible to getting colds and flus, things like that. Also, too, I can always tell when someone breathes through their mouth, my patients, because especially around the upper front teeth, the gums are always red and puffy and bleed very easily because our gums are supposed to be a little bit moist due to the saliva being on them when our mouth is closed. But when they get dried out and irritated, especially here, it gets really, really red and inflamed. So often I can tell someone is mouth breathing before they'll tell me that they are. A lot of times they don't really realize it. Kids can get chronic colds from breathing in those germs. So often too, when kids are mouth breathing, parents will often hear the kids grinding their teeth. It's because they're sliding their lower jaw in a way to help get more air down their throat, and often that causes grinding of the teeth. All my, especially male patients, older patients that have sleep apnea and they mouth breathe, usually their teeth are ground right down. The occlusal surfaces are ground smooth from grinding. So it's very wasteful of everyone's time, energy, and money that healthcare practitioners are not on the same page about this. Often I'm shocked that now I will say I'm thankful, the dental office I work for, the dentist does a lot of continuing education. A lot of dentists or doctors, people in general, let's be real, they, once they go into their field, they don't really do continuous learning, either for their own personal growth or for growth of their business or practice. So it's very frustrating when healthcare practitioners are not on the same page about things. Like, sometimes we'll refer a patient to an ENT, their medical doctor, and then the medical doctor says, no, like that's nothing to worry about, like making us kind of seem crazy. So we really all need to unite and spread the word about this. Yeah, mouth breathing, who knew, right? So proper tongue posture, I'm going to go over it with you. So with the tip of your tongue, place it to the roof of your mouth. So first I want you to feel the back of your upper front teeth. Feel where those are. Right behind there, on the roof of the mouth, the hard palate, you're going to feel some little ridgy bumps. So those are called the rugae. And then right behind there, if you place your tongue, you're going to feel a slope going back, okay? So it's almost like a concavity on the roof of your mouth. That is where I want the tip of your tongue to be, where that little slope starts, okay? And then the posterior, which means the back part of your tongue, the back 1/3 of our tongue is actually in our epiglottis. So the front 2/3 of the tongue is what we want on the roof of your mouth. So if this is the roof of your mouth, think that tongue is gonna suction cup up like that. So with your tongue, make the sound like this, okay? When you do that, you can feel the suction on the back part of your tongue hitting the roof of your mouth. So now do that, but pause right before you get to the noise. That should give you a pretty good suction to the roof of your mouth. You can also do a big cheesy grin. Raise your eyebrows. Say sing, sing. When you say the ing part, or you can say king, swing, sing, anything like that, you're going to feel the back of your tongue hit the roof of your mouth. So if that works better for you, you can also do that. So now you should kind of know where your tongue should be. Personally, for me, the easiest is when I make that noise. So when our mouth is at rest, when we're not speaking or eating, our lips should always be together. Teeth slightly touching, and tongue to the roof of our mouth. Now, if you're like me, your teeth might waver a little bit between touching a little bit in the back and being a little bit open or slightly apart. That's okay. I don't want a lot of space between your teeth. Also, I don't want you putting much pressure on your front teeth. Our front teeth only have one root, so they move pretty easily. So if you're putting even a light pressure consistently, they can shift over time. So again, to reiterate, lips together, teeth slightly touching in the back, tongue to the roof of our mouth. If you guys have any questions, leave it in the down bar below. Feel free to share this video.